Hello guys, welcome back to my YouTube channel. Today I'm going to discuss about the hypoglossal nerve, the 12th cranial nerve. Hypoglossal nerve is a purely motor nerve. It has only one functional component, general somatic efferents are the main functional component. It supplies lingual muscles developed from occipital myotomes, all intrinsic muscles and all extrinsic muscles of the tongue except palatoglossus muscle. Remember that very well. Hypoglossal nerve supplies all intrinsic muscles and all extrinsic muscles of the tongue except palatoglossus muscle. Then, when we talk about the nucleus of origin, the hypoglossal nerve nucleus is located in the inferior half of the floor of the fourth ventricle, deep to the hypoglossal trigone in the medulla oblongata, and it receives corticonuclear connections from precentral gyrus of the opposite cerebrum. The functional component I told you earlier as well, it contains somatic efferent fibers which arises in the hypoglossal nucleus for supply of all muscles of the tongue except palatoglossus muscle. After emerging from the nucleus, the hypoglossal fibers traverse anteriorly in the reticular formation of the medulla oblongata and line very close to the medial lemniscus. Near the anterior end of the medial lemniscus, the nerve fibers emerge between pyramids and inferior olivary nucleus as rootlets. Here you can see the hypoglossal nerve emerging from in between the pyramids and olive. Here is the olive and here is the pyramid. So it emerges between pyramids and olive. Then the rootlets of the hypoglossal nerve runs laterally posterior to vertebral artery and collect into two bundles which perforate dura mater separately near the anterior condylar foramen in the occipital bone. It exits from the cranium as the hypoglossal nerve trunk in the posterior cranial fossa through the anterior condylar foramen. At the base of the cranium, the hypoglossal nerve lies medial to the internal carotid artery. This is the common carotid artery. This is the external carotid artery which gives branches in the neck region, and this is the internal carotid artery. So, at the base of the cranium, hypoglossal nerve lies. Here it is medial to internal carotid artery. It inclines laterally to pass behind the internal carotid artery and 9th and 10th cranial nerves. It spirals around the lateral aspect of inferior ganglion of vagus to lie in front of the vagus nerve. Then it passes vertically downwards as here. Then vertically downwards, medial to the posterior belly of digastric. At the level of angle of mandible, it passes deep to the posterior belly of digastric and turns forward to enter into the carotid triangle. In the carotid triangle, the hypoglossal nerve crosses first the internal carotid artery and then the external carotid artery, and then it crosses the loop of the lingual artery just above the tip of the greater cornu of the hyoid bone. This is the hyoid bone, and it enters into the digastric triangle by passing deep to the intermediate tendon of the digastric and stylohyoid. In the digastric triangle, the hypoglossal nerve crosses the hyoglossus muscle. This is the hyoglossus muscle on its superficial aspect, and it lies below the submandibular duct and deep part of the submandibular gland, then passes deep to the mylohyoid to pierce the genioglossus. Here is the genioglossus muscle for supply of lingual musculation. It receives a large communication nerve from the ventral ramus of the first cervical nerve. Here you can see the C1, the meningeal branch. Here meningeal branch is coming with this hypoglossal nerve. The branches, the meningeal branch arises at the level of anterior condylar foramen to supply durament of the posterior cranial fossa. The upper limb of ansa cervicalis carrying C1 fibers arises in the carotid triangle, joins the lower limb of the ansa cervicalis, carrying the lower limb of the ansa cervicalis means C2 and C3 fibers from to form the ansa cervicalis. Nerve to thyrohyoid contains, this is the thyrohyoid, this is the nerve to thyrohyoid, it contains only C1 fibers. Nerve to geniohyoid, this is the geniohyoid muscle, and nerve to geniohyoid muscle also contain only C1 fibers, remember that. Then hypoglossal nerve supplies all the intrinsic muscles of the tongue as well as 3 extrinsic muscles of the tongue, stylopharyngeus, hyoglossus and genioglossus muscles, except palatoglossus muscle. Then you have to know how the nerve function is tested in a patient, as well as what happens if there is a lesion in the hypoglossal nerve. When you test the nerve function, hypoglossal nerve function, you ask the patient to protrude the tongue. If the hypoglossal nerves are intact, the protruded tongue lies in the midline. But if there is a unilateral lesion of the hypoglossal nucleus or of the hypoglossal nerve causes unilateral lower motor neuron paralysis of the tongue, the protruded tongue deviates to the side of the lesion. And in this picture, here the tongue is deviated to the left side. Here is the right side and here is the left side. The tongue is deviated to the left side. So, if there is a unilateral lesion of the hypoglossous nucleus, the protruded tongue deviates to the side of the lesion. So, if this deviates to the left side, then the hypoglossal unilateral nerve lesion is in the left-sided hypoglossal nerve nucleus. In bilateral lesion, hypoglossal nerve, the tongue lies motionless, causing difficulty in speech as well as swallowing. In upper motor nerve lesion, the hypoglossal nerve neuron nucleus is normal, but there is paralysis of the muscles of the side opposite to that of the lesion. Hence, on protrusion of the tongue, it deviates to the normal side. Imagine this is an upper motor neuron lesion. So, if there is upper motor neuron lesion in the hypoglossal nerve, it deviates to the unaffected side. That means to the contralateral side. Here in this diagram, if you imagine this is an upper motor neuron lesion, here it has deviated to left side, so the right sided upper motor nerve lesion can be seen. That's all what I wanted to discuss about this hypoglossal nerve pathway, as well as what happens if there is a hypoglossal nerve lesion, and also how you are going to test the hypoglossal nerve function. If you like this video, put a like and a comment in the comment section, and subscribe into my channel for more videos. Thank you for watching.